a specialist in biotech and global health. My guest today is a scholar with the Brownstone Institute and has experience with the World Health Organization. As an executive committee member with PANDA and a champion for truth and transparency in COVID analysis, Dr. David Bell says that fear and conflicts of interest have created a pandemic industry that is actually damaging to people's overall health. You know, one of the things that is just, there's a lot of things I want to talk about, but the first great big issue is this thing about a pandemic treaty. And it just sounds ominous that countries would hand some doctors in the WHO, and you could go ahead and correct me wherever I go off, because this is just, looking at this, the ability to declare pandemics and lockdowns and all the ramifications of countries closing and businesses, deaths. I was shocked with the very first time this came up that it literally, I think it affects the sovereignty of a country. But tell me about why you're so concerned about the WHO and this pandemic treaty.
Yeah, it's not just the WHO. There's nothing wrong with declaring a pandemic. We had a pandemic in 1968, 69 for, it was called the Hong Kong flu.
Right.
Million people died. We had Woodstock. We got on with life normally. They didn't close down countries. They didn't impoverish hundreds of millions of people. We just coped with it like adults. The problem now is that the WHO is a very different entity to what it was then. It's heavily influenced by private money and private individuals and corporate money. And there's a lot of money to be made in global health. The WHO was set up originally to help populations and focus on large burden diseases. It always had a role in pandemics. When there's an outbreak across borders, it's useful to have an organization that can help to sort of coordinate a response. But that never included removing people's basic rights. It never included, closing down countries, stopping trade, stopping people accessing a clinic. And the reason for that isn't just, some idea of freedom. It's because that's really harmful to health as well. So it's not just the WHO. There's a sort of a pandemic industry that has grown, and
right.
What worries me is not some theoretical loss of sovereignty, which is real potentially, but that depends on how much a country goes along with this. But we're creating a large industry of people whose sole purpose is to surveil for viruses, find some, theorize that they may cause a bad outbreak, and then close down people and design a vaccine, which is now going to be 100 days for an mRNA vaccine, which you then mandate and force people to take. And this is it's printing money for a lot of people, but it is not good for society. It's not good for health. And we've seen that with COVID, where it's sort of the first experiment going along those lines. And the result is a huge crisis globally in malnutrition, in increasing of other infectious diseases that are neglected, wrecking of supply lines, etc. We see it in the economy in North America. We see it much worse in low-income countries. And what the pandemic industry seeks to do is to make this almost a permanent way of doing things. It's based on a fallacy. The idea that pandemics are becoming more frequent is indeed historically not true. We had the Spanish flu in 1918 to 1920. That was the last really bad pandemic. Before that, we had them because we didn't have antibiotics, and we had big outbreaks of bubonic plague, outbreaks of cholera, etc. They don't happen internationally now. We have flu outbreaks. We've had 2 bad ones since 1920. And then we've had COVID, which, has killed a significant number of people, but most of the deaths on the statistics are probably people who died with it. They're nearly all elderly, they're nearly all very sick. So it's not like a bad flu that takes out a lot of younger people.
Mhm.
But the point is that pandemics are very infrequent. And the idea that we're living closer to wildlife now is simply a fallacy. We're not. There's less wildlife. So there's less chance of transmission from animals and even domestic animals where we used to live very closely. But most people now are in urban environments, they don't. So it's based on a fallacy which no one seems to challenge. And I think that's because there's so much money to be made in this that it is just driving itself.
So do you think, when you look at this, doctor, that I'm listening to you talk and I'm going, if we go along with this, thinking this is good for us to, in a global sense, protect each other and stand together, you're saying all we are doing is empowering corporations or organizations or groups of people to just print money, and they're the ones who are going to be in power. Not necessarily the first thing is to look after our health, their first thing is to make money.
Yeah, that's correct. The idea of a private corporation is to make money for its shareholders. So the job of Pfizer and Pfizer's board is to maximize profits for their shareholders.
Yep.
The job of BlackRock, which owns big chunks of Pfizer, big chunks of the New York Times, big chunks of CNN, etc., is to maximize profits for their shareholders. That's what even legally they're supposed to do.
Mm-hmm.
So that's why we have checks and balances. Is why we used to have very strong conflict of interest laws. So that there was a firewall between making this money for the shareholders and doing what's best for humanity. But now, now we see the CEO of Pfizer being touted as a public health expert who's there to advise the world on what medicine they should take next for their health. I mean, of course, he won't say, don't take any more Pfizer medicines because they may be bad for you. He will maximize the chance of you taking them because that's what his job is. So we've sort of turned health into a almost purely for-profit industry.
Yeah. So if we look back at the outcomes and the collateral damage that happened during COVID, talk to me about that. There were outcomes that we never expected, and there was collateral damage that mainstream media doesn't seem to want to talk about.
Yeah, I don't think anything was unexpected. We knew, and we've always known, and WHO has documents about this, that if you interrupt supply lines, if you reduce travel, etc., then you harm economies, and when you harm economies, you increase mortality, and for a whole range of reasons. And there are a series of UK studies called the Whitehall studies, quite well-known public health, where they looked at tens of thousands of people who work in the public service in the UK, and looked at, they showed that the higher up you are in the chain, the better off you are, the longer you live, taking all other factors into account. And if you're forced into poverty, you die sooner, even leaving out smoking, drinking, etc. So we know that making people unemployed en masse, etc., is harmful to health. We know that shortens their life expectancies. It also stops the kids going to college. It interrupts them, their ability to pay healthcare. In low-income countries, it's even worse because the health systems are much more fragile. There's a lot more infectious disease where if you cannot access a clinic, so if you're a child with fever immediately, then he may die, or she may die in 3 days' time from malaria. So as soon as you close clinics, as soon as you make travel hard, you increase mortality from infectious disease. So there's nothing new in any of this. If you stop screening for cancer or you stop giving chemotherapy, it's something like 40% of people in the UK stop their chemotherapy, then of course a lot more people die.
Wow.
Well, what is strange is that this was ignored. And, public health is, the basis of public health is risk versus benefit. There may be a benefit from a lockdown or a vaccine. There's a risk, and you weigh them. And you look at, is the cost worth the gain? Leaving aside the fact that you also have to give people a choice to make their own, because they know best their situation. And it seems there was some work on this by the Dutch, by the UK, etc., but these were never made public, almost certainly because whenever you sit down and do the calculations, you find that locking down a society for a disease that kills almost always old people who are already sick, you will never get a net benefit. You will get a net harm.
See, I'm listening to people now, and there are places that have statistics that I haven't had a chance to dive into them myself, but they're supposed to be experts that are saying that, kind of what you said and blown up, that these last couple of years of how these countries handled COVID, that the deaths they caused far outweigh any kind of people they saved. Would you agree with that, or what's your comment?
It appears that way. It's very hard with the poor statistics that we have, which is, a whole another issue. But
yeah,
the way that we've recorded COVID deaths is unique. We've never done this before because, if someone has a positive PCR test for a virus and they die 3 weeks later, for anything from cancer to a motorbike accident to pneumonia, you don't normally automatically attribute that to the virus.
Right.
But that is what we've done. So we've certainly inflated greatly. But we've also just talked about mortality and not how old they were, how many life years they lost. We normally talk about, we say a 5-year-old dying is more tragic than an 85-year-old dying in terms of the impact on life, obviously. Mm-hmm. So we've ignored that almost completely with COVID, because the vast majority of people die over 75, but we've just, in the media, they just talk about raw numbers.
Yeah.
There appears to be across Western and other countries an increase in young to middle age mortality. So it's hard to know exactly what that is from, but it is, what we expect when we make people poorer. And we also, we cut down healthcare access, we increase tendency towards alcoholism or drug use, et cetera, et cetera. So it's not, it's not surprising, and it's very hard to disentangle.
Right.
The numbers, how many died of the virus, which is some, certainly, and sure, those that died from lockdowns. But certainly those that died from lockdowns will on average be much younger than those who died from the virus.
Wow. Well, and what you're mentioning earlier, like my question would be, why would the WHO recommend things then that were already previously proven not to be successful?
Yeah, and which they recommended in 2019 you don't do in their pandemic influenza guidelines. So I think the answer is what we talked about earlier, that it was originally core-funded by countries. It was based on healthcare expertise. Now it's very much influenced by, for instance, software entrepreneurs who fund it to a very large extent. So if you go against what the funder wants, you don't get any more money. The WHO is full of humans. So the tendency is to do what your benefactors would like you to do so that you can keep salaries coming in the next few years.
What would you have done to improve the outcomes for patients and to avoid this economic social collapse that was created? Like, what would you have done to improve all this when you look back at it now? Because you sit in a pretty good seat to say some things.
So the first thing you do is you give people information so that they can make rational decisions. We knew in February, March 2020, the age distribution of death from COVID. Everyone should have known that. When they gave out death statistics, they should have explained who these people were, how they were dying. There was a lot of exaggeration of overflowing ICUs, etc. Some were busy, but if you look at the statistics, nothing like what the media was saying. So you never instill panic in the population, and that's what was deliberately done. You avoid conflict of interest, so you obviously don't have corporations and major investors having a direct say in the management of the of the
Yeah.
healthcare. And you focus on the people who are most vulnerable, which clearly in this case was, a very well-defined group of the population who are quite high risk. So you focus on them, you give them sensible care. One thing we did very early on, which is part of this panic, and the panic affects medical staff as well as the public, was intubation in emergency departments of almost everyone who came in sick with COVID. And it's standard knowledge in medicine that if you intubate a very elderly, frail person, it's very difficult to get them off the incubator. In New York State, about 90% of those intubated died in the early months.
Because of their elderly.
Because they're elderly, and intubation can be harmful as well. You can damage the lungs, etc. So, and when you make an old person, you paralyze them, which you have to do to intubate, then they're very prone to getting deep vein thrombosis, bed sores, etc. So you're putting these very old, frail people in a state where they're much less likely to survive. Whereas in the past, we would have ensured they were as active as possible. We would have used sort of positive pressure ventilation with a bit of oxygen, which they're finally using now. And we would have had physiotherapists thumping their chest, etc. But instead, we put people in hazmat suits for a virus that wasn't dangerous to most of those people, and treated these people in a way that we know in medicine is more likely to increase mortality. So it's a panic reaction, not just in the public, and there is no reason for that. I mean, personally, I think there was some intent in that. Because as we've seen, a lot of people got very, very wealthy through what's happened. But this is UNICEF data on South Asia. They published it. You've probably never heard because the media don't pick this up. But we hear about COVID deaths in India. We don't hear about the hundreds of thousands of dead children, the hundreds of thousands of girls being assaulted because they're out of school and so on, and at home, and they're in poverty, and unwanted pregnancies and teenagers, and et cetera, the disaster that we're causing in society. All these things used to matter. In the media, in the West, we had human rights organizations. Where are they? People don't realize how much we've lost. It's not just losing work. We've lost the whole idea that human rights matter.
See, some of the people that we interview will say things like, well, we should have known after so many months, but what I'm hearing you say is that we already knew that we shouldn't do that lockdowns don't work, intubate, like all these different things. It wasn't as though, we just discovered the things you're talking about. You keep saying that, no, we knew that. It was known when it comes to different areas, whereas some people say, well, now we've learned so much, we'll handle the next one better. But I'm hearing from you that a lot of the way they dealt with it that didn't work, that it was known that it wouldn't work.
Yes, it was known that it wouldn't work. Or it was known that it was very dangerous, and that if it did work a bit, there would also be huge collateral harm. That's, you can argue about whether it would have worked a bit, but we do know, if you lock down with the respiratory virus, it's still going to spread. You may slow the spread. So you can argue that if you're really going to get ICUs ready, etc., and you think that a lot of people are going to end up there, you can argue perhaps that for 2 or 3 weeks, slowing it down a little bit while you get ready. But that's not what happened at all. We know that there's harm from these measures. So we always have to weigh, even if it's 2 or 3 weeks, is that worth it for the harm? And probably even then, it was probably clear that it wasn't, because we knew that the age range and locking up taxpayers, for instance, and working people, it doesn't just stop them moving, it stops you funding your health system for the next 3 or 4 years, or in the future. So whenever you harm the economy, you're harming future health. And we know that that's not just learned. So we know that when we lock down a country, lock down the economy, we're storing up harm for the future.
What they're proving now in natural immunity is so much better, is what they're saying.
But that's another thing we always knew. I mean, this is one of the really interesting things about the pandemic, stuff like that. So the vaccine has one protein or part of one protein.
Mm-hmm.
You know, the mRNA makes that protein, yeah. It's one protein out of 4 in the virus. It's part of a protein. It's the protein that varies the most. So it's the last one you'd use for a vaccine almost. So, but if you're infected with a whole virus, there's all 4 proteins there. You know, it's in the cells it's in the mucosa, so you get mucosal immunity as well, which you don't if you inject into an arm. So, you know, all this is just basic immunology. We always know, if you've had measles, you don't need a measles vaccine. You know, it's just basic. So there's nothing new in this. We just pretended we didn't know. I'm not an immunologist. I'm just a public health physician, done a PhD, etc. But I mean, you don't need to be. This is basic immunology that you're all taught in medical school. Every doctor knows that. Every doctor with half a brain knows that natural immunity to a respiratory virus is probably going to be much more effective than the vaccine.
When you take a look at some of the things we've been talking about and the global thing that's going on, you could talk about it at a community level, hospital level, you could talk about it at a country level, but everybody gets news from everywhere around the world. And so very astute authors have written books about China. Others have written articles about China's influence with the WHO, and that we need to be very concerned, especially national leaders and politicians, of some of the things that are taking place when you look at the world. Is that something you see and sense from where you're at?
Yeah, clearly there's a lot of influences at play here. China is acting like, in many ways, like the other powers have in the past, perhaps, in trying to increase its influence, etc. The British, the Americans, etc. Russians have done this in the past and probably still do it, or clearly still do it. So I think China has been very influential on the WHO. It's also, it's a country of 1.3 billion people. They should have some influence. Clearly, in the West, we need to decide whether that is the sort of influence and the sort of society that we want to live under. I don't think we can say China should not have an influence. It's a lot of people. But we need to decide whether we allow that to influence the way that we live. But there are also a lot of other groups involved in this. The World Economic Forum has played a very big role, I think, in promoting the harms that have been done, and is continuing to do so. There are individual people who have got very wealthy out of this, who seem to be pushing this agenda for a long time. So I don't think you can put your finger on any one group.
Right.
If you look back in history, it's normal to be exploited, and maybe we're just back to normal. But there are quite a number of groups who perhaps appear to be working together, but because their interests happen to work together at the moment. So there are those who are trying to make a profit. There are probably those who are trying to increase their country's influence, etc.
Okay.
But I mean, underneath it all, it's certainly in the West. This has always happened in the world. In the West, we seem to have put aside sort of basic human rights and concerns of conflicts of interest. We've put this idea that these, it's almost, we're becoming like a feudal society, I think, and we're allowing ourselves to do that. We're following the dictates of this very wealthy groups of people and large corporations, etc. And I don't think we can necessarily blame China or other countries for that. I think we are, we're choosing a certain path that we've chosen in the last few years, that we're sort of reaping that.
A lot of people are taking advantage of what's going on.
Yes.
And
clearly. And in a way, you can't blame them for that. That's the way the world has always worked.
So what can we do as non-scientists, like the average person? There's these two echo chambers, but everybody should want truth when it comes to science and real statistics being interpreted properly, and the brilliant minds who should be consulted rather than people who just want to make money. Like, what can I do about it? What can the average person do about trying to help get us back to some sense of normalcy?
Firstly, question whatever you're told, and don't just assume that because someone says they're an expert, they are saying things for your benefit. They may be deliberately not doing so, or they may think they're doing so, but actually they're not you. They don't know your family. They don't know your values in life, etc. So there's no reason why they would be necessarily saying what's best for you. So we need to demand that we make our own decisions for ourselves, and we have that right. I think a lot of where we are is due to a sort of devaluing of humankind, and we're seeing people as numbers. We're seeing people, and we're seeing death as the end of everything, and we must stop that at all costs, rather than valuing life and thinking about what's actually important in life. And I think most people, they don't see the avoiding a virus as the most important thing in their lives, but they're allowing governments and people in charge to make that happen and make that the most important thing. So I think we've got to sort of retrieve the values of life, that the importance of family. The whole idea of allowing old people to die in nursing homes alone without any family visiting them is just insane, and so incredibly cruel. You can only do that if you see people as numbers and not as sort of intrinsically valuable beings who have something more than just a simple physical body and a lump of biology. So if we're being influenced by people, I think, who think that way, and we've sort of got to take back the reins of society and say that's not the way we're going to live.
Sounds like individual freedom has got to get back to being championed rather than just looking at the group or the whole.
And that doesn't mean not caring for other people, obviously.
No.
But if you look at history, whenever the group have been put ahead of the individuals, that's when things go wrong. That's when you have pogroms. That's when you start hitting whole ethnic groups. And it's when society ends up as a disaster. And so, if you value individuals, then you value their ability to make their own choices. That's where we need to be.
This has been excellent. We're out of time here, but thank you so much for being with us and giving us just a really good look at this. And we'll have to talk again and pick up some of these other topics that need to be discussed as well. Thank you for being with us.
Yeah, I'd love to be. Thanks for having me.